Welcome back to The Spark. And with us today is Julie Walker, founder of the Peyton Walker Foundation, whose mission is to increase awareness and survival rates for sudden cardiac arrest. We are also joined now by Ashley Forsberg, who is the managing director of the Peyton Walker Foundation, who will give us a tutorial in CPR and how to perform it. And again, if you would like to view this, and I encourage you to do that, we're going to put it on our website afterwards too, after the show, but I encourage you to watch it live by going to witf.org/CPR. Ashley, we're in a little bit of a, I have to pull my headphone wire here a little bit, but let me get to you. How are you today?
I'm great. Thanks so much for having us. This is a great opportunity to teach people how to perform effective hands-only CPR.
Are you able to do it in just a few minutes? Because I know most of the time there's some extensive training that goes into it, right?
Yeah. Our philosophy is you don't need to be certified. You don't need to take a 2-hour or a 4-hour class to learn CPR to do it effectively. Practicing it, taking a demonstration, that's all you need. You don't need to be certified to help someone who's in cardiac arrest.
All right. So who is this person that is on the floor here in our studio that you're going to perform CPR on?
All right. Well, we have Manny the mannequin here.
Manny. That's an adjective.
Yes. So the first thing we're going to do is we're going to recognize cardiac arrest. And so as we all saw, it is an immediate collapse. The person is unresponsive and not breathing. So that's the most important step, is actually recognizing this as a cardiac arrest. And so, our philosophy again is it's better to perform CPR on someone who doesn't need it than not perform CPR on someone who actually does. If the person doesn't need CPR, they will let you know. It is a forceful compression of the chest. So if the person is not actually in cardiac arrest, they will let you know immediately. So what we're going to do is we're going to recognize that this person is in cardiac arrest. We're going to get down here on the patient. Any clothing off the chest immediately. Don't cover up their mouth like that. But this is just, you want access to the chest here. And so what we're going to do is we're going to have knees along the body of the chest. You're going to be parallel to the body. You're going to put the heel of your hand the center of the chest. Now, us old folks, we might have heard nipple line. Now, as a woman, and many women will understand this, the nipple line is maybe not at the center of the chest anymore, so we're not going to worry about nipple line. We're going to worry about center of the chest. So you're going to feel that breastbone. You're going to put the heel of your hand here in the center of the chest, other hand overlap, fingers interlocked, and I'm going to be in a locked arm position, and I'm going to put my whole chest down, never leaving the chest with my hands, but I'm allowing the chest to recoil. So I'm going down 2 to 2.25 inches and then allowing the chest to completely recoil. Why am I doing that? The point is that you are performing the function of the heart right now. You are the pump. So you need that chest to fill back up, that heart to fill back up with oxygenated blood, so that when you press down again, it is pumping to the brain and all vital organs. So we are performing the function of the heart, pumping the oxygenated blood into the body and keeping that blood pressure high so that blood is going where it needs to go. So you're doing this 100 to 120 beats per minute or staying alive. So I'm going to just perform this for a little bit. And you hear that? That's the feedback from our mannequin letting me know that I am performing it correctly. I'm compressing hard enough. Now, if this was a human, you would hear bones cracking. You would hear some popping sounds. That's okay. This person is dead right now. So if I weren't pressing hard enough, they wouldn't be getting any oxygenated blood to their brain. So I need to press down and get that blood pumping, get that blood pressure up. And I'm going to keep doing this until EMS arrives. And I will just keep doing this. Now I'm going to stop now to show you what the next step in this process would be. I'm going to hands off the chest and I'm going to put an AED on this person. 2 pads.
Before you do that, so what you're saying is you continue to pump. You don't do a certain number of pumps and then stop and wait. You just continue to pump until EMTs arrive.
Yes. So, it used to be 30 pumps and then 2 breaths. We don't do mouth to mouth anymore. what's important is keeping the blood pressure high. So the second you take your hands off the chest, that blood pressure plummets. And so as lay people, most lay people are not able to effectively give breaths to benefit taking the hands off the chest. So their focus is on the chest, keeping the blood pressure high, and only doing those compressions. So it's very simple. Call 911, push hard and fast on the chest, and shock with an AED when available. So our function is just being the pump for the heart. Right.
So while you're getting the AED out, let me also ask this question. You said no mouth to mouth. Is there a time when mouth-to-mouth resuscitation is warranted?
So the only time really you should do mouth to mouth is if it's a known drowning, when there is no oxygenated blood in the body. So known drowning, potentially a choking situation after that obstruction has come out. But really, even in those situations, you really should just focus on giving high quality compressions and not worry about the breathing. Let the professionals come and do that part. Just do what you can on the chest.
Mm-hmm. Okay, so this is the AED.
Yeah, so this is a training AED.
The child button.
But what happens is AEDs talk to you.
Apply pads
and
as shown
it tells
in
you
the pictures.
to apply the pads, and it shows you exactly where to put
Apply
them.
pads
You put
as
it on the
shown
upper
in the
right
pictures.
chest, lower left kind of
Press
abdomen,
pads firmly
and it
on
tells you
skin.
exactly what to do. And it will walk you through
Apply
every
pads as
step of
shown
the
in the
process.
pictures.
And once it gets to the proper
Apply
place,
pads as
this
shown
might not
in
do
the
it.
pictures.
It's a training one, so the pads have been used up pretty
Press
good.
pads firmly on skin.
So, Julie, are these the AEDs that are handed out at schools and athletic events?
Right. So to date, we've put about 450 to 500 AEDs out in central Pennsylvania, and we won't stop. It's a huge project that we know there's such a need for more AEDs in the community.
Go ahead.
Yeah, so what happens if this were working properly? It would actually advance to the next step. And the next step is that it analyzes the heart rhythm. So AEDs are smart. They will not shock a person unless they are in a shockable rhythm. So I'm speaking right now. I could put a live AED on myself. It wouldn't shock me because I am alive. I have a sinus rhythm. Now, someone who is in a shockable rhythm, ventricular tachycardia, ventricular fibrillation, that would recognize it, and it would send an electrical impulse across the heart, hopefully restarting it so that it would start into a sinus rhythm. Now, if you were to perform CPR and put an AED on an individual and they are resuscitated, leave the pads on. People in cardiac arrest can go back into cardiac arrest, so you want to leave everything as it is until EMS takes the pads off of the individual. Your job is just to stay here. If the person is not shocked back into a shockable rhythm, the AED will tell you to start performing CPR again for another 2 minutes, and then it will analyze the rhythm again, and it will continue to go through this cycle until EMS arrives and takes over the scene.
So these AEDs that have been handed out, there are instructions. I assume that someone who finds someone else in cardiac arrest can follow the instructions pretty easily?
Right. Anyone can use an AED. You don't have to be trained or certified to use it. So we want to make sure they're very accessible, so people can save a life when needed. You can't wait for EMS to arrive.
Ashley Forsberg with the Peyton Walker Foundation and Manny, thank you very much for being with us today.
All right, thanks so much for having me.
I have to tell you, Julie, that this was so valuable, even if it's for a short period of time. As I mentioned to Ashley, we know that there are a lot of CPR training courses out there, but this just seems like something that everyone can learn in a short amount of time.
Oh my gosh, absolutely. And we've got a video posted on our website that we watch it for 4 minutes, and it goes over all of these instructions. Anyone can learn it. It's a basic knowledge. Everyone should know how to do it.
Have you ever had to do it?
No, but we've been, with this new project, we're launching the 4-Minute City, and I'd love to come back and talk to you more about that. We're putting 300 AEDs in Cumberland County. There's an app that we get alerts when there's somebody in cardiac arrest in our community. We can go and respond. So we may be called to do that at some point.
When I said earlier that it's not that unusual, how unusual or how often does a sudden cardiac arrest occur?
Well, we know there's between 400 and 600,000 cardiac arrests in our country every year. It's a huge issue. It's the number one killer of student athletes. Every hour, every day, we lose a child to cardiac arrest. So It is an enormous health problem, and I think all of us as citizens, really, we want to be good neighbors. Let's learn CPR. Let's demand that AEDs are accessible as well.
Julie Walker is the founder of the Peyton Walker Foundation. Julie, always good talking with you, and I know you're busy. As you said, you have a regular job along with this, even though this may be your passion. And so many people have been paying attention and want to learn more about heart health since the incident in Cincinnati Monday night. Julie, thank you very much for being with us today.
So grateful for being here. Thank you.